And next, I'd like to begin our research showcase and introduce Dr. Beth Murray-Davis, who is going to be presenting to us today on making space for midwifery in the hospital, exploring the birth environment of Canada's first Alongside Midwifery Unit. Beth is an associate professor in the Midwifery Education Program and Department of Obstetrics and Gynecology. She's a co-PI for a CIHR Clinician Investigator Team grant examining non-communicable diseases in obstetrics. Her current research interests include pregnant people's experiences of healthy nutrition and exercise during pregnancy and the postpartum, fetal movement awareness, midwifery experiences of caring for complicated pregnancies, clients and healthcare provider experiences of alternative models of practice for midwives, and client decision-making about place of birth. Dr. Murray-Davis has worked as a midwife in Hamilton since 2003. Welcome, Beth, and you can go ahead.
Thanks, Liz. And thank you, Julia. That was such a great talk. I feel like we're changing gears very drastically, but hopefully people can turn their heads to a different topic. And I want to recognize that I'm speaking today on the traditional territories of the Anishinaabe and Haudenosaunee nations on the lands protected by the Dish with One Spoon Wampum, same as Liz. And in particular, I want to recognize that Indigenous practices of birth, health, and well-being have been in place in this territory for over 10,000 years and are maintained to this day. I offer this acknowledgement as a way of recognizing and respecting Indigenous peoples, past and present, and as a first step in the spirit of reconciliation. So I'm really happy to be here today to talk with you about this little piece. I have only a short amount of time, so you're going to get really a little snapshot of some of our findings. And this is part of our larger evaluation of the Markham-Stouffville Alongside Midwifery Unit. And this project actually came about really organically in the process of our evaluation. We have been doing lots of qualitative research with healthcare providers and clients who give birth on the unit. And we kept hearing over and over again about the impact that the space and the place and the unit was having on their experience. And we wanted to explore that in more detail. So I'm going to give you a little slice of that. And I am here as part of our team, and you can see the names of all the other contributors on this slide. So first, a little bit of background. Many of you are familiar with the midwifery-led unit or Alongside Midwifery Unit as a model. It's certainly growing in popularity globally. You can see it across Europe now, quite prominent in Australia and New Zealand. But the Markham unit is the first of its kind in Canada, and it opened in 2018. We know that there was some intentionality in the design of the unit. So hospital leaders consulted the literature about how you design a birth space and what does the evidence say about that. And we know that they consulted the Birth Unit Design Spatial Evaluation Tool, or BUDSET tool. And there's lots I could tell you about that tool in a separate chat. And so we wanted to see a little bit about how that impacted people's experiences. A few kind of notes about terminology before we really dive into things. I think it's really important when we talk about a home-like setting, which is what a lot of the research tends to mention on this topic, is that the concept of home isn't universal. And I think when we deconstruct that term, what we see is that people like to think of the idea of a home-like setting, and they're talking about the idea of safety, security, autonomy, domesticity, familiarity, the comforts of home. But it's important to note that home isn't a universally safe or welcoming place for all of our childbearing people. And the other terminology that I want to just mention before I talk about it in great detail as we go forward is this concept of the built environment. And so really that's defined as the surroundings created by and for humans and where the setting of human activities takes place, which is quite broad, as you can imagine. What we were thinking of when we wanted to set out to do this evaluation was to think about the physical spaces of the unit. So that included the architecture, the design, the decor, the stuff that you will find in places. So tools and equipment and resources, all of the amenities that people can find when they're in the space. And we also included really everywhere that you could go on the unit. So that includes the birth rooms themselves. It includes bathrooms, common spaces, hallways, clinical offices, and meeting spaces, etc. So to set the scene, I wanted to show you a picture of a traditional birth room, as many of us who work in a Canadian context will recognize it. And this is in the same hospital where the Alongside unit is in existence. And this is where midwives and clients would have given birth just months before the unit opened. I'm going to let you reflect as you look at this picture on what jumps out at you. So, you know, what is prominent in this room? What catches your eye? What feelings do you get as you look at this? It has, you know, the traditional trappings of a hospital birth room, I think. And I'll contrast that now by looking at one of the rooms on the Alongside unit. So again, reflect yourself on what jumps out at you, what looks different. There are certainly some of the same things visible as you saw in the last photo, but there certainly is, I think, a bit of a different look and feel. One of the things to take note of is that the bed doesn't feel like a focal point in the same way, and I'm going to talk about that as we move forward in the findings today. These beds are actually folding Murphy beds, so they go up and against the wall and out of view if not needed. And it's interesting to contrast these beds, because I think this bed, dare I say, even looks a bit inviting, almost like a hotel room or something, not like a traditional hospital bed. I think there's also visibly some more space for people, and I'm going to talk about that concept too. So the existing literature on the impact of the built environment on healthcare experiences has really grown up out of fields like palliative care and oncology. And there's certainly lots of research to show that elements of the space, so including how light is used, color, nature imagery, can have an impact on people's experiences of healthcare. There's also some growing literature on the impact of that, you know, workspace design and the intentionality that can go into it, and the impact that that has on healthcare providers. And so there's some association that we may see it reduces stress. There may be enhanced safety for teams as they work in intentionally designed spaces. There may be even improved productivity, and certainly some gains in job satisfaction. There's a small body of literature that started to look specifically at this built environment in the birth space. And, you know, I think what we've seen there, the key messages are really that things that facilitate that relaxation and comfort and allow people to support physiologic birth, we see those improved outcomes associated with satisfaction and outcomes for moms and babies. So here's another image of how one of the rooms will look like on the Markham Stouffville Alongside Midwifery Unit. This is how it might look when the person arrives in labor. So the bed is not in view, but there is lots else that is easily accessible and easily visible. So you'll see a sling hanging from the ceiling, the peanut ball is visible, floor mat. There is a birth chair that is kind of cut out of view. So not a lot of those traditional trappings that we saw in that earlier image. And really actually not a lot of technology other than that small little cart with potentially the, you know, thermometer and blood pressure cuff, etc. Here is another image of one of the birth spaces on the unit. So set up again with the floor mat. You'll see there's a large inflatable pool where people could have a water birth or could labor in the water. There's a low chair for a healthcare provider to kind of sit and do some charting nearby. This picture, I think, really captures nicely some of the nature images that have been incorporated in the unit. So there's quite expansive wall wraps and murals in each of the rooms, and they all have their own kind of nature theme. So this happens to be the waterfall room. So I'm not going to dive into our methods in a lot of detail because I want to keep it short and snappy and focused on my findings. But as I said, the aim of this particular element of our larger evaluation was to really understand that the impact that this environment has on people's experiences. And we wanted to explore that from both the healthcare provider view and the client view. And we underpin this by a socio-spatial conceptual approach, which is a very big way of saying that essentially we wanted to consider not only the physical space, but also the meaning that people invested in it. So the people who interact in the space, How did they think about it? What do they think? And that goes beyond just the physical space of the room and the design elements and the decor and the paint color, to include things like the sociocultural expectations and norms and the things that construct our thoughts and feelings and how we react to the environment. So there's a lot more kind of packed in there. This was a mixed method study, but I'm just going to be sharing with you today some of our semi-structured interview findings. The questions that we used for both of those elements, though, were developed by our research team based on the literature. We used a grounded theory approach to data collection and data analysis for the interviews. We collected data in 2 phases, and that ultimately ran from September 2018 to March 2020. You can see here that we ended up speaking with 28 service users or clients and 14 midwives. So what did we find? I think the key message from our research is that making space for midwifery in the hospital contributed to the positive experiences and satisfaction with birth for both clients and healthcare providers. And when I talk about making space, I actually mean it both literally, as in they physically created a separate space for midwives within the hospital, which is a big deal. And I also mean that we're making space figuratively, that midwives and service users were given space, they were given freedom, they were given power, and they were allowed and facilitated to support physiologic birth and midwifery approaches to care. So when we went into the data in more detail, what we found is the ways that we think that became possible was based on these 3, key necessary ingredients, if you will, to make space for midwifery. So creating a domestic space, shifting technology, and sharing ownership. And I'm going to go through each of those in a bit of detail. So first, when it comes to creating domestic space, we know that there was a lot of planning and thinking that went into the design to make it feel more home-like, that it was meant to be more welcoming than a traditional hospital room. And you can see that in those images. So there's lots of elements of comfort. The colors were intentionally chosen. Things feel soothing and soft and welcoming in a way that they don't traditionally feel in a hospital room. And the impact on people was profound. So we heard from both care providers and clients that, the words like calming, welcoming, peaceful kept coming out over and over again in the data and in the interviews from chatting with folks. I think one of the big findings that came out about this feeling as well was that there was space for family. And I think that's something that we don't traditionally go into or we don't think about a lot, is that birth really is a family event. And they felt that in the birth space, there was room for that. There's a family lounge, and that meant that their people were welcomed and allowed to be part of that space as well. And then finally, what we heard over and over again from particularly the clients is that this home-like setting, or this comforting, familiar setting within the hospital, to them felt like the best of both worlds. What they felt was that they were comfortable and relaxed and in control, but they felt like they had proximity to emergency services when needed. So one client describes that it didn't feel like a typical hospital room. They loved the murals, the different atmosphere. They appreciated walking through the calm hallways while they were laboring and reading even things like motivational quotes on the walls. The second necessary ingredient in how to create this space for midwifery was about shifting the technology. So we found that it was a common practice to really remove the unnecessary equipment and technology from the birth space. And that was done, in some ways intentionally, but also out of necessity. So there were some elements of shared equipment, like the continuous monitoring, the panda warmers, that because they needed to be shared between birth rooms, they ended up not being physically present in a room when people arrived. And what that did was actually create a sense of space, a sense of airiness, a sense of bigness in the room that allowed also for mobility and movement and flexibility, and allowed new equipment to come in that previously hadn't been allowed in the birth space because of lack of room. So that's where we see the slings and the mats coming into play. And this was a really powerful way to shift both visually and in that feeling away from a biomedical and technological focus for birth. And then I spoke earlier about this really powerful feeling of not having the bed as a focal point. So I think when the bed, not being visible when the person arrives in labor, actually changes how they labor. The bed becomes an entirely different space. That medical bed that we saw in the earlier picture looks like a place for procedures, powerlessness, being a patient, whereas the other bed that we saw, actually people attached an entirely different meaning to it. They felt like it was a place for comfort. It was a place for togetherness with family. It was a place for rest and bonding. So very different meaning attached to it. A quick quote from a midwife about this, and they describe how, in the same rooms, they felt like they didn't have space, and now they feel like they can use the whole room. And they often say to their clients, live your life anywhere in this room, the whole thing is yours. And they see that clients then bring out more personal belongings, pictures, and little bits that might make it feel more comfortable for them. The third element that we found was a necessary ingredient is this sharing of ownership. So for the first time ever, midwives had their own space, a separate place where they were free to be a midwife without judgment, where they had their own space for meetings, for a locker to hang their things, a whiteboard to write messages to each other. And again, this was a very powerful thing for midwives to feel for the first time. For clients, they felt that the birth space was very customizable, very adaptable to their needs. They could modify it, work with the room as they needed to. And again, this resulted in such a feeling of ownership and belonging. And so this sense of belonging where the space becomes your own was really a profound thing that many people discussed, and that they felt that it was a co-creation by the midwives and the family that was there to welcome the baby to create the space together. So a couple of quick quotes for that. So a service user described that they felt like they had ownership. They could walk around, they could get into different positions that could help, and they could do what they needed to keep calm as best as possible. And a midwife described that they feel a great sense of ownership in the unit, and that it feels very different than when they used to walk onto the labor and delivery unit, and that they feel like it's our place and that it reflects their philosophy of care. So a few key take-home points from these findings. So the first is that the intentional design elements that are incorporated into the Alongside Midwifery Unit did have a significantly positive impact on the work experiences of midwives and on the birth experiences of clients. It facilitated feelings of ownership, control, flexibility, and I think those are powerful feelings in terms of how people reflect on their birth. I think it's really important to note, though, that these findings and this feeling is not due to the space alone. So it's not about just getting the paint color right or the fabric right. It is about the co-creation of how the space is used and given meaning. And what we found from the data is that how the space upholds and promotes midwifery philosophies and approaches to care are the most powerful. So what do I think are some of the implications of this? I mean, I think there's lots we can unpack, and this is really the start of that. We are working on a publication from these data, and I think we will be able to go into it in more detail. But this, I think midwives traditionally have borrowed space in the hospital, and that even when we attend birth in someone's home, it feels like a borrowed space. And this shift from borrowing to belonging is very powerful and meaningful for people. And I think that there's a lot that we could delve into related to the impact of that on midwives and on our profession in terms of satisfaction, burnout, stress, all of those things. I also think that there's something we probably need to explore about what it means to allow more people to have access to this best of both worlds and this home-like setting, or this feeling of comfort and familiarity, that, maybe the positive outcomes and the positive views of home birth could actually be accessible to a wider group of our clients through this type of unit. And then the final thing is just to think about, even from the images you've seen today, simple ways that you can retool the space to reinforce and promote physiologic birth and midwifery approaches to care in the institution where you find yourself. I think we can start small and make meaningful changes for people that will have an impact. So these are some references if you want to dive a bit deeper into the content. And I want to thank the women and birthing people and families and the midwives who participated in this research and who continue to give meaning to this birth space.
Thank you so much, Beth. What a really fabulous presentation. And there's just so much rich ideas here, I think. And I agree that the potential impact that this might have for the profession in terms of addressing some of the concerns and challenges that the profession faces are really important to reflect on. We're right at time. It looks like there was one comment in the chat, which I think maybe I'll just share with the audience, and then you could maybe follow up in the chat if you have a response to it, Beth. It's from Ginny, and she says, "Thanks for this presentation. It's really fascinating to hear how powerful space is for childbearing people. And she wonders what the results would be if you applied some of these same methods to people with other healthcare providers working in a typical obstetrical unit. So definitely an interesting question, Jenny. Thank you so much, Beth.
Thank you, Liz. Thanks, everybody.